It is time for the Centric Health Hour. We have Dr. Bridgebaum. He's one of the presidents of Centric Health of Bakersfield. Dr. Bomby, welcome back to the show. How are you, my friend?
Very well, Richard. How are you? And sorry to learn about JR's daughter. That's so cruel.
I know. Is it, Chris, let me know when JR's on the phone here, Okay. Dr. Bomby, would you mind entertaining a question from JR about his own condition?
Oh, absolutely.
Okay. Let JR take it away. Yeah.
JR is on the line.
JR.
Yes, sir.
Take it away. Dr. Bomby's listening. Yeah.
Good afternoon, Dr. Bomby. How are you?
I'm well, JR. Sorry to learn about your daughter.
Yeah. Unfortunately, found out today, she woke up this morning around 5 o'clock in the morning. She had crawled into bed with me and started coughing, and it almost sounded like a bronchitis or like a croup cough. It was real heavy and deep, like it was affecting her vocal cords. And I got concerned, and she kind of went back to bed, so I just monitored her breathing for the rest of the morning, and then she got up at 8:30 and had another bout, and so I took her into the urgent care, and they prescribed her some stuff and then said if we wanted to get her tested, which we did, and it turns out that she is positive.
Wow. And JR, when was it that you had the virus?
I had COVID. I think I tested positive for COVID back on February 2nd.
Okay. And you were out for a couple of weeks, right? Yeah.
I was out for 2 weeks. Yeah, I was out for about 10 days and then went through the whole protocol. So yeah, I was out for 2 weeks.
Right. So what's your question for Dr. Bomby, JR? Yeah.
Well, one, is she going to be okay? I guess that's my main question. I mean, she seems to be doing fine now. But the doctors seem to say that she would be fine. They gave her an antibiotic and a steroid. And put her out for 10 days, I believe. And then my main question, I guess, is what are my what are my chances of catching it again?
Yeah, because you have not had the shot. You've had the virus. You're carrying the antibodies, but you have not been vaccinated.
I have not been vaccinated, no.
Right. What do you think, Dr. Bomby?
It's pretty unusual to have a 4-year-old girl catch COVID and to be symptomatic. That's pretty unusual. From the treatment perspective, I don't know if the antibiotics are going to do any good, and steroids are generally indicated if a patient is sicker and is exhibiting hypoxemia or low oxygen level, and it's a little late in the game. So I don't know if they change the trajectory of the disease in her age. At her age, it should be pretty benign, statistically speaking. You can always have 1 in a million incidents, but I'm very optimistic she's going to do well. But as far as you contracting the virus again, the probability of that is extremely low. It's never zero, but extremely low. We don't have too many what we call repeat infections yet. So I feel good that you won't get the recurrence of infection.
What should his protocol be, Dr. Bomby? Should he be doing the same type of isolation that he did the first time he had the virus?
By definition, he doesn't need to do that because he already has the immunity. It's acquired through natural infection. So it's the same way. The CDC has guidelines. If people have been vaccinated and they have an exposure, they don't need to isolate or quarantine anymore. That's the advantage. That's the purpose of having the immunity.
Right. And would there be anything, JR, I'm just taking over here, sorry. Would there be anything to prevent him from going to get the virus now? I mean, the fact that his daughter tested positive and he's been exposed, would there any reason why he wouldn't go ahead and get vaccinated now?
That's a very important question. So what CDC recommends is if a person has had the natural infection, they should wait up for 3 to 6 months before they get they say 90 days, but I would say up to 6 months before they get a booster dose. And what we have been doing all along in this country is instead of limiting the previously infected to 1 dose, we've been administering 2 dosages, which is really a waste of the second dose. and waste of resources. Because when a person has been naturally infected and they get one booster dose, the antibody response in studies is 140 times higher, 140 times higher. So there is no real reason to have a second booster dose. And for some reason, CDC hasn't really implemented that in its set of policies, and we've been lining up people for second dosages after infection when they really don't need it.
Wow, that is the first I've heard of that. I want to make sure I got that. If you have had the virus, like JR, you're saying just with a single dose that you get all of the protection you need. Is that what you said?
More than the 2 dosages of the vaccine if you didn't have the infection. So infection plus 1 dose that's all necessary. There is no reason to have the second shot.
That is amazing. What do you think of that, JR?
Yeah. I'm ready to be superhuman.
All right. All right.
Now, let me ask this: if I were to go get tested again, is it possible to still test positive from when I had it back in February still?
Ooh.
So there is a possibility in some people that the dead components of the virus will keep on testing positive. So the PCR test that's used to ascertain the infection doesn't distinguish between the dead and the live virus. Even if you test positive, it's likely to be a dead remnant of the virus. The only way you have to distinguish between dead and the live would be through viral cultures, and we really don't need to go that far.
How do you know, doctor, if it's a dead virus or a live virus? I mean,
that's what we have found in checking the people. Right? So most of the people who have longer duration of positive testing with PCR, and don't have immune compromise, it's not really the live virus; it's the dead virus. So they are after 14 days, even if they test positive and they have otherwise been afebrile and everything else, they don't need to quarantine anymore. There are some people with immune compromise who will harbor the virus much longer. So when you have confusion, then you really have to get the viral cultures, and that's really a difficult thing. So I don't know how many facilities are able to do that.
Dr. Bami, why is it you said it was rare for a young girl, 4 years old, to have the virus? Why is that?
So in different countries, we have a pretty consistent observation that the kids are less likely to get the infection. The probability of getting the infection is much lower, and then having a symptomatic infection is even further lower. It's not zero, but it's extremely low probability. And that was one of the reasons that we were bullish on opening the schools, because the kids tend not to have the infection, and even if they have it, they don't spread it as much, and they don't have much of a seriousness of disease that's common with the elderly people and comorbidities.
Wow. JR, anything else?
No, yeah, like I said, they prescribed her some medicine for 5 days. I think it's prednisolone. Yeah, it's a prednisolone. That's the steroid. And again, I think there may be some difference of opinion here. The steroids are generally indicated in sicker people. But I think she'll do fine either way. I mean, the kids are very resilient. So, and I certainly wish her luck, and I feel very optimistic she's going to do well.
Yeah. All right. Very good. All right. Well, JR, I think that's good news all the way around, don't you?
I agree. Thank you very much for letting me call in, and hopefully they'll let me come back to work next week.
Yeah, and JR Flores, thank you for listening to the Richard Bean Show. We appreciate that.
Oh, yes, every day, Richard, every day.
Loyal listeners like you are you're the wind beneath my wings. What can I tell you?
Well, and Dr. Bombi is my favorite guest, so.
Dr. Bombi's your favorite guest. Thank you, JR. Appreciate it.
Thanks, guys. Appreciate it.
All right. Let's get back to Dr. Bombi. Dr. Bombi, one of the big questions that all week, the lingering story has been on these blood clots coming from the J&J vaccine and what that means. We talked last week about, one of the unintended effects or consequences of this will be just add to the reluctance or the resistance of some people to take the virus, just give them, another excuse. Can you talk to us about the clotting and what it means and and bring us up to date on the science of it?
The question of clotting started with the AstraZeneca vaccine in Europe, in Germany, in Norway, and subsequently also in France and England. But the probability of having a clot, which is generally in the brain, it's called cerebral venous sinus thrombosis, which is a clot in the blood drainage system of the brain that can have some adverse consequences, and some people have even died from it. It typically has occurred in childbearing age in women only. So it's important to recognize if this complication is really related to the vaccine or it's a statistical occurrence in that subset of people. So far, both AstraZeneca and J&J came in today, and they have said they can't really say for sure there's a cause and effect relationship. On the other hand, there have been some people who have done the studies, and they have noted that in addition to the clot in the brain, there is a blood cell called platelets, which tends to prevent the bleeding from inside. Their numbers have dropped down, suggesting that the vaccine may have somehow stimulated immune system the wrong way, that it becomes an autoimmune, it becomes destructive against its own blood cells and causes clots. But that's an unsettled question. What is important, where the downstream consequences of this clotting thing are, that, as you mentioned, it could potentially increase vaccine hesitancy. But we should also recognize that, as Justice Brandeis said, sunlight is the best detergent or the best disinfectant. So nothing pertaining to the clotting or any complication related to that is being swept under the rug. It's being scrutinized openly and honestly. So therein lies the comfort level that nobody is thrusting or imposing their will or opinion on others. As and when a complication arises, it's being thoroughly investigated to see if there is a cause and effect relationship. Also, there was a study in Oxford that released yesterday. It's again it's not peer reviewed, and it's a preprint. So in other words, not many people have cross-examined the study. It shows that the risk of the same clotting is 8 to 10 times if a person is getting the infection as opposed to the vaccine. So the statistical occurrence in our part of the world, we have had 7 million people in the U.S. who have taken the J&J vaccine. 1.4 million have been the women of that age, and 6 have been infected. So if you just confine the statistical analysis to women, then there is a disproportionate occurrence of clotting in 1.4 million. Normally it would be 1/3 as much. It won't be 0, it'll be 1/3 as much. But then the real question, Richard, comes to is, where is the greater good? Is the greater good in stopping it or recognizing the resurgence of infection? So I think the best way would be to segment the population which is exposed to the risks, which is childbearing women. Don't give it to them, but work around it. So the men, no problem. Older women above the age of 50, no problem. So the last thing we want to do is, with the resurgence of infection across the world, now the world as a whole, while U.S. is doing well, not great, but well, the whole world is really approaching the other peak, second peak like the first peak, and there is a virus running rampant in India, in Turkey, in Poland, in Brazil, and those are the places where the virus can have another variant or mutant that can come back and haunt us. So we really have to throw the kitchen sink in our approach towards vaccination. And these clotting disorders do stress the existing system. And also, China, for instance, today started putting a bid to buy Pfizer vaccine. When J&J is stressed, when AstraZeneca is stressed, then the logistical burden falls on Moderna and Pfizer.
Wow.
And those vaccines are very difficult to make, and the scaling up, they're doing a stupendous job of scaling it up, but that really puts the world behind. So I certainly hope that the cause and effect settles not against the vaccine because the world needs it. At the end of the day, AstraZeneca vaccine is the one that was going to liberate the world because of easy dispensability, single shot, not special storage conditions, and multiple other benefits. But if this happens, if there's a cause and effect that's proven, then I think we stand to lose as a world.
Oh boy, man, that's bad. Now, could for the women of childbearing years, could they just take would you recommend? Could they take Pfizer or Moderna instead of J&J?
So yes, for both the messenger RNA vaccines based on Moderna and the Pfizer technology,
that would be okay.
They have no demonstrable clotting disorders, so it's a very safe alternative for that subset of humanity to go for that vaccine.
Okay, all right. And did it surprise you, Dr. Bomby, you're talking to Dr. Bridge Bomby of Centric Health, when the CEO of Pfizer mentioned yesterday that it looks like some form of booster, we've been talking about this for weeks, some form of booster shot, either aimed at the variants or whatever, is going to be necessary, much like maybe the annual flu shot. Did you expect that?
I didn't think there was much of a surprise in that statement. If there was any surprises, that's more of a speculative thing because it isn't based on reality right now. Because so far, the immunity through the vaccination hasn't been compromised. So we really don't know how far it goes. Does it go 1 year, 2 years? So depending upon where it dilutes or stops, a booster dose may be necessary. But again, so if you talk about talk about Johnson & Johnson and AstraZeneca vaccines having limited usage, and then you have other countries like China trying to buy into it, and then we need the booster dosage, that really puts stress on the supply side, and that can be a challenge. And we talked about also the fact that the patent protection and the intellectual property rights have to be protected. While they need to be protected, we need to find ways to go on the war footing to expand the production capabilities of Moderna and Pfizer so they can fill in the void that will be created by Johnson & Johnson and the AstraZeneca vaccine problems.
Oh, man, it's so interesting. All right, we are out of time with Dr. Bridge Bomby of Centric Health. Dr. Bomby, always appreciate you having on. I hope you have a great weekend this weekend, sir. You sticking around town, leaving town?
I'm around, working
Good.
hard.
Of course you are. All right, Dr. Bridge Bomby, thank you, sir. We'll be talking to you next week. All right, thank you.